and then to those who are unable to join us today can watch it. I think I'll send it to your teacher and then they'll circulate it to you guys. So do you guys have the notes for CPR and BLS for this week? Have you guys been sent the PDF earlier? Okay, so today's class is on CPR, and it's something that we've discussed in the past lessons. So whenever you find a casualty who's taken unconscious without a pulse or breathing, that means you have to perform CPR. Okay, and CPR stands for Cardiopulmonary Resuscitation, and from the name of it itself, it tells you that it has to do with your cardiovascular system, your heart, your pulmonary system, which is your lungs. So cardiopulmonary and resuscitation means revive. So it is done for, to someone who does not have a pulse or normal breathing. Okay, and we'll talk about normal breathing in a while. Okay, so in the past, I believe we talked about things like unconsciousness because due to heart attack, unconsciousness due to hypoglycemia, stroke, and head injury, right? So in these cases, there is a chance that the casualty can have a cardiac arrest, okay? And when you have a cardiac arrest, as in their heart isn't pumping anymore, so what happens is that you cannot deliver oxygen through your body. And we spoke about the importance of oxygen in the past, right? We talked about how certain organs in your body, especially the brain, are very sensitive to oxygen deprivation. And at the slightest insult, lack of oxygen, they'll start to die. So we talk about oxygen, okay? We talk about how if you don't have enough oxygen, the cell will die, and in the brain, the cell death can be irreversible, and you will cause brain damage. All right? So this is a diagram showing you the urgency of CPR. So the chart over here tells you from the 0th minute, that's when respiratory arrest starts. Okay, you don't breathe. And then the 4th minute is when cardiac arrest happens. Okay, your heart stops beating and it's an electrical problem, right? We talked about the difference between heart attack as well as cardiac arrest. One is a circulatory problem, one is an electrical problem. So in cardiac arrest, the heart stops beating. Okay, that's called at the 4th minute. And the 4th to 6th minute after that, the brain cells begin to die. And at the 10th minute, there will be irreversible brain damage. So 10 plus minute will be irreversible brain damage. If the casualty of your patient somehow comes back to consciousness, they might suffer from long-term brain damage effects. Okay, so it's very important to start CPR as soon as possible. Okay, and we'll move on to the next thing called chain of survival. So we talked about how important it is to perform CPR as quick as possible, right? We talked about the importance of oxygen, especially to your brain. And we have mentioned in the past about the circulatory system and how your heart plays a very important role in pumping blood to deliver it throughout your body. Can you have blood vessels for that? But the heart plays that pumping role. And the chain of survival has 4 components, okay? The first component is early recognition of the signs and calling for help. So what I meant by this is you need to be able to recognize the sign of, for example, a heart attack. In the past lesson, I think the week 5, if I'm not mistaken, we talked about signs and symptoms of a heart attack, right? You have excessive sweating, chest pain, and the pain spreads to your left, the jaw, the shoulders, the neck, and the back. So being able to recognize these signs and being able to call for help can prevent an occurrence of cardiac arrest, in the sense that you call for help and you get sent to the hospital, get treatment before they collapse without a pulse or breathing. Okay, so that's early recognition of signs as well as calling for help. After that, say the casualty has fallen unconscious, all right, collapsed without a pulse or breathing, you need to be able to commence early CPR. And in CPR, we also emphasize on high quality CPR. And this is to buy time. Okay, to buy time between the moment you start to call for help to the casualty arriving at the hospital, at the treatment facility. So that's to buy time, CPR. Okay, and we'll talk about the high quality CPR in a while. Okay, and then the third one is early defibrillation, and this you can use an AED, which we'll also talk about later. I think to most of you guys haven't seen an AED before, so there will be a video to show you how to use it as well as how it looks like. it could be pretty fun. Okay, so that's early defibrillation. And this defibrillator, the function of it is to reset your heart rhythm. It because it's automated, so it will assess your heart rhythm, analyze your heart rhythm, and when it's a shockable rhythm, all right, then it will advise you to deliver shock. Okay, and in movies or like media, you've probably seen things like a manual defibrillator where the doctor will rub two iron-looking devices together and then say clear, and then they shock the patient. That's a manual defibrillator. And no, you don't rub it like that. Okay, so in an automated defibrillator, the iron thingy that they used to rub comes in sticker electrodes, like their pads. You stick on the casualty's chest area. And we'll go through that in a while. Okay, but that's the third component of chain of survival. And the last component is post-resuscitation care. And this is at the hospital, okay? Then this is to restore the casualty's quality of life, because you need to be able to deliver certain medication to rehabilitate the casualty, the patient, after they are resuscitated. Okay, any questions so far? So for today's lesson, we are focusing more on the CPR bit as well as the AED bit. Okay, that's the second and the third component. All right. Okay, so we talked about being able to recognize signs and symptoms. Okay, in say heart attack, it will be chest pains. In stroke, it could be the FAST, using the FAST algorithm. And we even talked about other stuff, BEFAST, right? Balance, eyes, and FAS, facial, arm, and speech slur. So being able to recognize these signs can lead to you calling emergency services earlier. And in Malaysia, the emergency service number is 999. Okay, so you call emergency, request for an ambulance, tell them what you're encountering, an unconscious casualty without a pulse or breathing, tell them to send an ambulance to you, request for an AED, or actually they will know what to do, but you can also like make specific demands, like order, okay? This is to tell them that you have this kind of casualty at hand and you need certain support, okay? This is also applicable. So for example, if you're dealing with not a cardiac arrest case, for example, a trauma case, like let's say an MVA, a motor vehicle accident, you want to be able to tell them how many casualties, what kind of situation you're dealing with, is a disaster, how many people are involved, so that they can send the appropriate amount of manpower, as well as equipment. Okay? And then CPR, we talked about it, and we will talk about more of it in a while. Okay? Defibrillation using an AED as soon as you can. So an AED greatly increases the chance of survival. Doing CPR alone it is good, but it's not as good as using an AED on top of CPR. So we emphasize on early defibrillation. Use an AED as soon as possible, and hopefully you can find one around, okay? And the thing about AED is that in Malaysia, it's not that established yet. Not everyone knows. I mean, people still don't know how to use it, or they're afraid to use it because it's new to them, and also because it's not widely available. So AEDs should be available, readily available, and easily accessible in places where there are crowds. For example, shopping malls or airports, schools. So whenever there's like, say, a set amount of people gathering at one point of time, there should be an AED on standby, because you never know when a cardiac arrest can happen. And an AED really does save lives. Okay, any questions so far? So this is how you position an AED. This is just a quick picture, since some of you might be curious. So yeah, there are sticker electrodes, the pads. You just stick on the casualty's chest like that, and then you switch it on and you listen for the prompts. Okay. And then we talked about advanced care, early advanced care at the hospital. So this can help to further stabilize the casualty's condition. It can, some casualties, they have a non-patent, unclear, an obstructed airway. So you want to be able to bring them to the hospital so that they can be helped better. You know, the doctors can put airway, tools and other things to help them breathe better. And that's important. Okay, this is to stabilize the casualty. And some of them require certain drugs and certain corrections to the underlying cause. Okay, any questions so far? Okay, so the objective of CPR is to restore the partial flow of oxygenated blood. So we talked about oxygen, we talked about blood circulation, and we talked about the role of the heart in all of this. So when you do CPR, you're restoring that flow, and this is to prevent cell damage because certain cells are very sensitive to oxygen deprivation. And we talked about which organ that is, right? Which cell, and that is the brain. So by restoring this flow, we are hoping to prevent tissue death and possible brain damage. Okay. And when do you do CPR? You do CPR when you find a casualty who's unconscious, and we talked about unconsciousness using the ABPU scale, right? Not responding to a voice or painful stimuli, closed eyes. So when a casualty is found unconscious without breathing, all right, without normal breathing or absent, just complete absent breathing, you can do CPR on them. Okay, and what is abnormal breathing? So abnormal breathing includes things like agonal gasping. Okay, and it looks something like a fish out of water, where they take deep gasps, but they're not actually, it's not effective. So whenever you see breathing that's not normal, and how do you know what's normal? You and I, we are breathing normally. So if you don't see this sort of breathing on an unconscious casualty, they are not, and you have to assume that they're not breathing normally, and hence you must do CPR. And whenever you're in doubt, you commend CPR. It is better to be safe than sorry. Sometimes in a like a situation, you're panicky, you're scared or whatever, someone is unconscious, collapsed. You're not very sure. Is this normal? Is this not normal? Can you feel a pulse? Can you not feel a pulse? And if you're not sure, you should go and proceed with CPR. Okay? Any questions? Okay, cool. And this is the algorithm we use for basic life support for this CPR situation. We use the algorithm DRS ABCD, doctors ABCD. Okay, and D stands for danger. That means you have to ensure that the area is safe for you to enter. For example, if it's a burning building or if it's like a place with toxic fumes or like in the middle of the road, you have to be aware of your surrounding and be very careful. Okay, remove danger. Okay, be aware of the dangers surrounding you. Enter the scene when it's safe. Ensure that there's no danger on you or the casualty. So if you're wearing something hazardous or there's something around the casualty that's dangerous, something that's on the casualty that's dangerous, you remove it. Okay? And response, we do, for us, we do the shoulder taps. So tap firmly and speak loudly and clearly to request for response. So you can say things like, sir, can you hear me? If you can't hear me, please open your eyes, or please show me a sign with your right hand, left hand, whatever. Okay, you want to be able to elicit a response, and if you can't elicit a response, you can consider that person unconscious. We talked about unconsciousness in the past. Okay, we use the ABPU scale, right? So that's response. And if a person is unresponsive, what you want to do next is you want to send for help. Okay, so you can call the emergency line, 999, and you must be able to get an AED around you. So you do this by asking someone else to do it. So you can shout for help, okay, call out, you sir, you there in the black shirt, please call 999, and you there, sir with the blue pants or blue shirt, please help to get me an AED and automated external defibrillator and get back to me. So asking for help will sort of like save you time so that you can proceed to the next step. And the next step is opening the airway. Okay, opening of the airway because when someone's taken unconscious, their airway is likely to be closed, obstructed, not clear. So when that happens, you need to do a maneuver to manually open the airway. And this maneuver we call head tilt chin lift. Okay, so what happens? How you do it is that you put your one hand on the forehead of the casualty, and the other hand on the bony part of the chin. So you tilt the forehead up and you lift the chin up. Head tilt, chin lift. This opens the airway, open the mouth, look into the airway, the throat. Okay, look into the throat, the airway. And you should be able to see a clear airway, nothing obstructing it. There's no blood, no mucus, no fluids, vomit, food, objects. Okay, make sure it's clear. And after that, you want to lean forth and look, listen, and feel for breathing. So you see this diagram here, right? So there's an eye, that means you're looking, the ear for listening, and the skin for feeling. So look, listen, and feel for breathing. So you're looking for chest rise. So when we breathe, our chest rises because our lungs expand, it inflates. So looking for chest rise for signs of breathing, listening for breath sounds, and you're also taking note whether is the breath sounds normal quiet breathing, or is it abdominal gasping, the gasping that I mentioned just now. Okay, and you want to be able to feel for warmth, the warmth of the vapor exiting the casualty's mouth and nose as they breathe. Okay, so that's breathing. Look, listen, and feel. And if you find that there's no breathing or abnormal breathing is present, abnormal breathing or no breathing, you want to commence CPR as early as possible. And you want to be able to administer or apply AED, a shock, as soon as possible, if it's indicated. And who tells you if it's indicated or not? The machine tells you that. AED tells you that. Okay? Any questions so far? All right. So danger, about the place, about you, about casualty. And this is how you can check for danger.
Area is safe for me to do CPR. Now removing danger from the casualty's body. Glasses put to the side. Loosening any tie. Taking off any watches put to the side.
Okay, so in this imaginary scenario, the demonstrator has showed us that glasses, watches, restrictive clothing, belts, these are considered hazards. You want to be able to loosen it or putting it aside first before you commence CPR. Okay, that's first. Response, we talk about shoulder tapping, loud and clear voice, asking for a response. Sir, are you all right? Auntie, uncle, ma'am, boy, girl, are you all right? So asking for a response, this is how you can check.
Sir, can you hear me? My name is Joshua. Are you okay? Can you hear me?
Okay, so in this scenario, he introduced himself real quick. So like, hi, my name is, so my name is Dash. Can you hear me? If you can, please open your eyes. Okay, it's also good to elicit a response, a specific response. So tell him to open his eyes. Tell him to move his hands. Make a specific response. I think opening eyes is the best because it's the easiest to see and as well as to do. So eye opening, okay. And then if there's no response, you want to be able to send for help. Okay, send for help means calling for emergency service 999 and requesting for an ambulance. Okay, as well as getting an AED. And if possible, get 2 people to do this, 1 for 999 and 1 for AED, so that you can split the workload and get it faster. Okay, and this is how you do it. Oh, and if you're alone, you want to be able to, you still have to call 999, but in order to save time, you can put the person on loudspeaker, put the operator on loudspeaker as you proceed with the next step, which is airway. Okay, multitasking a little bit. And this is how you send for help.
Help, help! You in the black shirt, can you call 999 and get an AED and report back to me as soon as possible? Thank you.
Okay, so in this scenario, he asked one person to do both AED and 999. There's nothing wrong with it, but if possible, if there are more people around, split the task. Okay, 1 for 999 so that they can focus on that, and the other one for AED so that they can focus on that. Okay, and you want to be able to tell them to come back to you, like report back to me, get back to me as soon as possible. Okay, because you need to know what the status of the ambulance, ETA, for example, the estimated time of arrival of the ambulance. You want to know whether the AED is available. So if you send someone to get the AED, but he never returns, you never get an AED. So you never get to do early defibrillation. Okay, so sending for an AED, you make sure the person comes back to you. Say after 10 minutes, they're not back, you probably want to consider asking another person to go get an AED. Maybe that person forgot, or he chickened out, or he just like ran away, who knows. Or maybe he is looking for one, but he doesn't know where to look for, so he went off. Okay, so AED is important. It does increase the chances of survival a great deal, so try to get that as much as you can. I think the nearest the AED I keep seeing around is in Cheras. There's this mall called My Town Shopping Mall. Have you guys been there before? My Town, Sunny Velocity. I think they've got AEDs readily available in the mall itself, and I think that's a great step. I think all the malls in Malaysia should have that. In fact, malls, schools, universities, campuses, hostels, they should have an AED in case of emergency. Okay? Any questions so far? Okay. So after you send for help, you want to be able to open the airway to check for airway patency or clear airway. So how do you do that? You do the head tilt chin lift maneuver. Okay, put a hand over here, tilt it backwards, and lift the chin up. And when you do that, you should be able to visualize the airway. Look into it. Look into the airway, the mouth, okay, and see if it's clear. Okay, this is how you do it. One hand on the shoulder, one hand on the chin, the bony area. Okay, look into it. And when you lift the chin up, make sure you are using the jawbone, the bony part, and not the soft area. Okay, you have like a submental area over here. It's soft. You don't want to be pressing it up because it can hurt. Okay, and yeah, so you want to hold the jaw, the chin, okay, the hard part to lift it up. And then after you open the airway, you want to check for breathing. And we do looking, listening, and feeling. Look, listen, and feel for breathing sounds. Okay, look for chest rise like that. Look for chest rise. Listen for breath sounds and feel the warmth of the vapor against your cheek. And remember, gasping is not normal breathing. Okay, a gonal gasp is not normal breathing. And if there isn't breathing or if there's abnormal breathing, you must begin CPR. Okay, and this is how you check for breathing. Open airway and then put your ears over here. Okay, your cheeks-ish area over here. Look at the chest rise. Listen for the breath sounds and feel the warmth against your skin. Okay, that's how you check for breathing. That's B. So we went through A, B. The next one you do is C. C for CPR or circulation. And when there's no breathing, no normal breathing, you must commence CPR. As early as possible, do CPR. And CPR consists of 30 compressions, 2 rescue blows in 5 cycles in 2 minutes. So when you do CPR, we talk about 30 compressions and 2 blows, right? 30 compressions and 2 blows equals to 1 cycle. And you must be able to complete 5 cycles in 2 minutes, okay? And this is how you position your arms, your hand. You have to put it in the central chest at the sternum. So you guys can actually feel, okay, in the center of your chest, there's a flat piece of bone, okay? And that is called the sternum. And the sternum lies above your heart. So when you compress on the sternum, you are compressing the heart. And this helps like an external compression, helps the heart to pump blood because the heart has failed to pump blood, function as normal. So you need to do like external manual compression of the heart. That's what this is essentially, right? Chest compressions. So 30 compressions, 2 blows, 5 cycles in 2 minutes. So what is with this 2 minutes? You know, what's with this timing and whatnot? So this is part of the high quality CPR component. Okay, you must be able to push hard and fast, and of course at the right place. So over here you can see it's central chest. Okay, central chest, and you must interlace your hands like that. And when you push, it's downward, not diagonally. Don't push this way. Go downward. Okay, push downward. Okay, and this is how you interlace your fingers, and not like that, for stability and maximum efficiency. And how deep must you push? Okay, so this is how you push. Push hard and fast. By hard, I mean as hard as you can to achieve 5 to 6 cm for adults. That's how deep you must compress. And by fast, we're talking about 100 to 120 beats per minute. Okay, and if you do the calculation yourself, 100 to 120 beats per minute, 30 compressions, 2 blows, 5 cycles, that's about 150 compressions, you will come to almost 2 minutes time. Hence, that's why we say 5 cycles in 2 minutes. Okay, like say you do 120 beats per minute, that is 2 beats per second, correct? So doing 150 compressions will take you about 75 seconds. And the other seconds are used for rescue breaths, for example. Okay, and of course, it's not possible that you compress at a very steady, consistent rate of 120. You might go down to like 110, 115, 120, get over the course of the 2 minutes. And it's okay, it's fine. Okay, but the point is, we want to have a guidance, like a guideline, and the guideline says 5 to 6 cm. Okay, at least 5 cm. And you want to compress hard and fast, push hard, push fast, 100 to 120 beats per minute. And as you can see here, this person, when he does compression, it's a downward force. Okay, first of all, it's a downward force, not diagonally, because you might break the ribs. If you position your hands wrongly, say you position it slightly to the left or to the right and not central chest, you can risk rib fracture. You can break the person's ribs. And it's a very common question for people to ask, like, if you break the person's ribs, do you continue or do you stop? So the answer is you continue, because broken ribs can heal, but not giving them blood circulation will kill. Okay, so the priority is on chest compressions. If you hear a cracking sound, you broke the rib, fine, it's fine. Forgive yourself, move on. Okay, continue chest compression. And the chances of breaking ribs is quite low if you're doing it correctly. But if you break a rib, it's likely because you have the wrong positioning. Wrong positioning, wrong force vector, you're pushing at the wrong place, wrong angle, wrong vector. So that can happen. So make sure it's a downward force. Lock your elbows so that it's a downward force. You're not using your biceps to push. Okay, you're using your back muscle over here, the back and the shoulders to push downward. Okay? And what about the beat? So for some of us who are like, we learn music, you guys learn music and you guys are very familiar with beats. 100 beats per minute on the piano, the metronome is, I think it's andante. So if you're not familiar with like stuff like that, that's okay. You can always find a song or a beat or a tune which follows 100 or to 120 beats per minute. Have that in like muscle memory it, and then it'll come out naturally. And one of the songs that people recommend, at least in the past, is "Staying Alive" by the Bee Gees. It's a band. It's quite an old song, and it sounds like this. This song is very famously used to guide the rates for chest compression. Okay, I make you guys sit through all 45 seconds of it because I hope at least now the song's kind of stuck in your head. But if it's not, that's okay. Go find your own 100 beats per minute song or 120 beats per minute song and follow that instead. That's fine. Okay, so this song you can use to help you count. And of course, the rate is important, but the quantity is also very important. So make sure it's 30 compressions to blow. So count out loud. It might help you to keep track of how many compressions you've done. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 2, 2, 3, 4, and so on. Okay, so this can help you to count, and as well as, like, for example, if you do have to stop doing CPR and someone has to take over, they know exactly how many you've done. Okay, and you try to finish that round before you pass hand over. Okay, now another criteria of high quality CPR. So we talked about pushing hard and pushing fast, at least 5 cm, 100 to 120 beats per minute. That's hard and fast. The third criteria is complete chest recoil. So you have to allow complete chest recoil. Okay, and this is what we meant by complete chest recoil. When you push down, you allow the heart or rather the rib cage to spring back, recoil. It has to go down and let it come back up. Okay, go down, come back up before you push again. So you don't do this. This will be counterproductive. It's like squeezing a squeeze bottle and not allowing it to sort of like re-expand. So it does not do it. It's not effective CPR when you do that. The heart needs to be able to. Have you guys ever learned in circulatory system phases of the heart, a heart rhythm, the diastole, systole, and diastole? So allowing chest recoil allows the heart to undergo diastole, the filling phase. Okay, so that blood can go back into the heart and be pumped out again. So allowing chest recoil allows the heart to expand and be filled with blood before you squeeze it out again. Okay, that's why you have to allow complete chest recoil. Compress, release for every compression. Okay? And the fourth criteria is minimizing interruptions. So do not let yourself be distracted. If you want to give rescue breaths, don't take too long. If you want to attach AED, don't let it disturb your CPR. Have someone else to help you to get the AED, to apply the AED pads, to switch on the AED. So you minimize interruptions. Okay? Now, rescue breaths. Rescue breath is given after the head-to-chin maneuver. Open the airway, pinch the nose. Okay? And you want to ensure tight seal of your lips around the mouth of casualty. And when you give the breath, it is 1 breath per second. 1 breath for about 1 second, not too much to avoid excessive ventilation, and not too little as well, because you want to be able to observe chest rise. When you blow, you have to be able to observe for chest rise. So blow, eyes to the chest, observe chest rise. That tells you that your blow is effective. You have delivered one effective blow. Okay, chest rise, it means that the lung expanded, the air you ventilated, so the air you breathe in, you expired to the casualty, entered the lungs, and will be diffused into your blood stream. So observe for chest rise. And of course, at this time and era, it's controversial to perform rescue breaths for everybody. So it's okay if you're unable to give rescue breaths because you are unsure about the person's disease status, whether is he infectious, does he have COVID, does he have certain transmissible, communicable diseases. So if you're not sure and you're unwilling to give rescue breaths, don't worry about it. It's fine, justified. Just do chest compression, and that's what we call a chest compression only CPR. It's okay to not to opt out of rescue breaths, and that's also why when you do want to do rescue breath, we encourage you to have a protective device like a mask, a rescue mask, or a face shield. Sorry, one of those shields before you perform rescue breaths, especially for strangers. If it's someone like a family member or a partner and you're sure and you don't mind, then go ahead, perform rescue breaths. Okay, so this is how you do chest compression.
Casualty is not breathing, starting chest compressions.
Okay, so as you can see, elbows locked and he's using his body weight to compress downwards.
2, 3, 4.
And he's counting out loud. And rescue breaths are given like that. Head to chin lift, pinch the nose, seal the mouth, and blow. And observe the chest rise. Okay? Now, remember, the qualities of high quality CPR are push hard and fast, okay? Allow complete chest recoil, as well as minimizing interruptions during compression. Any questions so far? Okay, so defibrillation, use the AED, and an AED stands for an automated external defibrillator. Okay, whenever it's available, use it as quick as you can. And it's because it's automated, it does everything for you, sort of everything for you. All you have to do is to switch it on, okay, put the pads as shown in the diagram, and listen to the instructions. So what it will do is it will analyze your heart rhythm to determine whether it's a shockable or non-shockable rhythm. If it's a shockable rhythm, they will advise you to press the shock button and it will deliver the shock for you. But if it's a not shockable rhythm, it will advise you to continue CPR for another 2 minutes before it starts analyzing again. Okay? And how do you use an AED? Here's a short video, about 3 minutes, to show you how to use an AED.
For emergency help. Ask them to bring an AED if one is available. If you're alone, make the emergency call yourself on a mobile phone or speakerphone and start CPR with chest compressions. Do not leave the casualty to look for an AED. Keep doing CPR until someone brings an AED. As soon as the AED arrives, ask for it to be switched on while CPR is continued. It will immediately start to give you a series of visual and verbal prompts informing you of what needs to be done. If someone is with you, ask them to follow the instructions until emergency help arrives.
Call for help now. Remove all clothing from patient's chest. Pull red handle to open bag. Look at pictures on pads. Peel one pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Press pad firmly. Peel other pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Evaluating heart rhythm.
Stop compression, Susan. Stand back.
Stand by.
The reason why you stand back for the AED to assess the heart rhythm is because it's very sensitive and will pick up any form of movements. So it will give you an inaccurate reading of the heart rhythm. So you do not touch the casualty during analysis of the heart rhythm, and you do not touch the casualty during shock.
Stand clear, everyone.
Shock. Everyone clear. Do not touch patient.
Stand back.
Delivering shock. Shock delivered. Provide chest compressions and rescue breaths.
So after the AED is administered, the AED has given the shock, you have to continue CPR. Okay, and as you can see, the man, during the analysis of heart rhythm, he tells everyone to don't touch, stand back, right? And when the rhythm is assessed and deemed shockable by the AED, he also says, stand back, everyone, stand back. So ensuring that no one touches the casualty during shock is very important. Okay, so you can say things like, I clear, you clear, everyone clear, and then have them respond to you by saying clear. That's a very good way to ensure that no one is touching the casualty. Can help you to minimize collateral damage. Okay, so after 5 cycles of CPR, what do you do? So you need to check for signs of life again, and you do that by using head, touch, and lift, and look, listen, and feel for breathing. Other signs of life can be things like body movement and cough. So the person starts to move, they start coughing, that means that they are alive. Okay, they have signs of life. Okay, and if they are breathing already, normal breathing, I mean, you can move them into a recovery position. And if there is no normal breathing, even after 2 minutes of CPR, even after the shock, you need to continue another 5 cycles of CPR, another 2 minutes, and then check for breathing again. And if no breathing again, continue CPR and repeat this until normal breathing is present. So what is the recovery position? So here you can see a recovery position. Okay, you must be able to put the arms like that, fold it in towards you, put it on the cheeks, hold up the legs to a 90-degree position, and turn the casualty over. And when they're turned over like that, this hand supports the head and open the airway. Keep the airway clear, open the airway, tilt it. And this knee supports the body from rolling onto the stomach. And make sure to stay with the casualty at all times. Do not leave them alone. Because if they are, for example, they have come back to, they're conscious again, and then, but then they can easily go back into unconsciousness or have another cardiac arrest, another episode, and you must be at the ready. You must be able to provide CPR as soon as possible should they go back into unconsciousness, no breathing, no pulse, should they collapse again. And after you put them on recovery position, in the recovery position, you want to be able to constantly and regularly monitor their vital signs, their breathing, their heart rate. Okay, well, mostly the breathing. Make sure they're breathing at all times while waiting for the ambulance to arrive. Okay, and this is just a quick one to show you how to do the recovery position.
His legs are straight. Then take the arm nearest to you and place it at a right angle to the body with the palm facing upwards, like so. Take the other arm and bring across their chest and place the back of their hand against their cheek nearest to you and hold it there. With your other hand, lift the far knee up until their foot is flat on the floor. Whilst keeping the casualty's hand pressed against their cheek, pull on the far leg and carefully roll the casualty towards you and onto this side, like so. Once you've done this, adjust the top leg so that it is at a right angle. Tilt the casualty's head back so that the airway remains open. If needed, adjust the hand under the cheek to help to keep the airway open. If it has not already been done,
okay, so that is how you do recovery position. So don't forget, open the airway and monitor for signs of life. Monitor the vital signs, monitor the breathing rate, make sure they're breathing at all times, and if they're not, be ready to commence CPR again. Okay? So when do you stop CPR? When can you stop CPR? You stop when the person starts to breathe again or show response. Okay? That's called the return of spontaneous circulation. Means they are back, they're fine again. So you stop when they are showing breathing or when they're showing signs of life, showing response. You stop when you're tired or when you can be replaced by someone else. So for example, you're tired of doing 120 compressions or after 250 compressions, you're tired, get someone to help you to continue the compressions if possible. Okay? And you also stop when help arrives, when ambulance arrives and the paramedics arrive. Okay, and then you're taken over by them. Okay? If you see them like you hear the sirens 500 meters down the road, you don't stop CPR yet until they are there, until the paramedics come to you and takes over from you, and that's when you stop. Okay? So if you can use a face shield, this is a CPR face shield. It allows you to sort of like protect, is a bit of a protective barrier. But like I said, if you're uncomfortable with doing mouth-to-mouth, that's okay. No worries. Just do chest compression, only CPR. And do not leave the casualty alone because they might go back into another cardiac arrest even after they showed signs of life after CPR. Okay, any questions so far? So if there are no questions, I would like to say thanks for listening, and I hope after learning about CPR, you're more confident to administer CPR to a person in need. And remember, when you do it to someone who's unconscious without a pulse or breathing. And if you're not sure about the breathing status, it's too shallow, you can't determine, then it's better to be safe than sorry. You can commence CPR. Okay? With that, thank you very much. Have a nice day. Cheers.